Hi guys, my name is Zane Ferguson. My client is Jason Halston. He's 37 years old. The differential diagnosis for Jason is called cyclothymic disorder, and the primary diagnostic features that go along with cyclothymic disorder, there are two of them. I'll start with the first one here. Cycling between depressive and hypomanic symptoms that occur with this disorder, but they lack the severity of a major depressive or hypomanic episode. The second diagnostic feature is that they must be symptomatic for at least 2 years. Now I'll tell you guys a little bit about my client, Jason Halston. He's a 37-year-old male. He's a computer salesman, and he's seeking psychiatric help. He's kind of pushed along by his wife in this aspect because she's said that she's going to file for divorce if he doesn't figure out what's exactly wrong with him. And now in Jason's eyes, this is what he's kind of experiencing is something that everybody goes through. He calls them good days and bad days. So a bad day for him is when he wakes up, he doesn't want to get up. He wants to sleep and usually will sleep for 12 to 16 hours a day. He lacks energy, no confidence or motivation. He'll even call in sick to work. And he basically just kind of turns into a zombie. He doesn't want to even get out of bed. If he does, the most he does is move to the recliner and watch TV all day. When we kind of asked Jason how long does he have these bad days for, he said that as long as he can remember, he's had days like this. They usually don't last that long, usually 3, maybe 5 days at the most, and then he gets back to what he calls good days. According to Jason, these good days, he's really just sociable, he's more confident. He just thinks that things kind of come to him more quickly, and he's thinking on his toes, and he's living life as he should be. Now his wife doesn't even take kindly to these good days, as Jason tends to drink and use marijuana on these good days, and the wife has also caught Jason cheating on her a few separate occasions. And part of this has to do with Jason being kind of overconfident, and these are quotes, he thinks he is a powerhouse of a man, and that it's his duty to share himself with as many women who desire himself. And he complains that his wife doesn't understand that. Usually these good days last anywhere from a week up to a month. And usually when they end, a bad day follows almost immediately. Just kind of when he wakes up the next morning. Kind of going back to when Jason was in school, his grades weren't that good because he had these good and bad days. He was never a consistent student. He was always kind of considered like a bright kid when he would put his mind to it, but that he just didn't have enough motivation to really make anything of himself. And so like I said about work, he does call in sick when he has bad days, and that's leading to not very good sales numbers for him. And although he is a charming person on his good days, his bad days have led him to alienate his friends because he's kind of hostile and irritable when he has to go out on these bad days. Now I'll go ahead and tell you guys about his multi-axial diagnosis. Axis 1 is cyclothymic disorder. Axis 2 and 3 are both none. Axis 4 is his relationship or his marriage is in jeopardy and he's having some work difficulties. And Axis 5, his GAF score is 60. Moving down now to the theoretical perspectives, he's only got one, which is the biological perspective. And I went ahead and wrote that genetic inheritance most likely plays a role in this case. Usually the same genetic factors that contribute to the development of bipolar disorders lead to the development of cyclothymic disorder. It may also be due to a deficit of serotonin, which can contribute to his depressive symptoms. And likewise, an excess of norepinephrine may be responsible for his hypomanic symptoms. So that's all I've got today for you guys for Jason Halston. Thanks for watching.